In terms of the impacts of feeding higher levels of milk solids early in life and then after weaning, so we've weaned the animals and looking at longer term impacts on health, we have quite a bit of data, or at least we have a handful of data from my lab showing that we might be getting improvements in health of those calves. So we have some early data where we just looked at some functionality of immune cells and showed that, at least among Jersey calves, these calves that were previously fed higher levels of milk solids had improved leukocyte responses or immune cell responses when we challenged it in a petri dish, for example. Then we moved to actually challenging these animals, and we did a salmonella challenge orally, and we actually showed that the calves that were previously fed higher levels of milk solids had improved leukocyte responses and actually reduced inflammation and a tendency for reduced clinical disease. And then most recently we did a respiratory challenge, a combined viral and bacterial challenge in some calves that were either fed lower or high levels of nutrition. And about a month after weaning, so these animals were fed the same starter, those calves that were fed higher levels of milk solids previously had decreased mortality and actually decreased inflammation. So when we looked at all the data together, it actually showed that those calves that were previously fed higher levels of milk solids had overall better resistance and response to that combined viral bacterial respiratory challenge.